I'm Dr. Jaydev Panchawagh. I am chairman of Synapse Brain and Spine Foundation and a senior consultant neurosurgeon at Sahyadri Hospital in Pune. Over the last many years, neurosurgery has advanced very rapidly, and few examples can be very high magnification microscopes, which also deliver good light at the depth, because one of the challenges is the depth. Then computer guided brain surgery, in which navigation is possible. So computer guided navigation literally uh, guides you inside the brain where you want to go, avoiding important centers of the brain, so that you take out the pathology without touching the other parts. So you can be the best thief possible, as they say. You take out the pathology and don't keep any marks anywhere. So that is now more and more possible. Then we have what is called as CUSA, which is able to suck the tumors without touching the brain. We are able to plan surgery ahead, before the surgery, exact entrance, exact execution, etc., which was not possible few years back. So all in all, what has happened is that these technologies have come together and they are still evolving. Day by day, they are evolving, and they have made brain surgery safer, more effective, with lesser complications and more effectiveness. So regarding these technologies, there are certain challenges which we face. Though with the time, I think they are reducing, but they are still there. One of the important challenges, of course, the cost of the equipments. And you know how the cost translates into the need of use of the equipments. For example, if I buy an instrument worth 1000 rupees, let's say, and it is bought on loan, so that money has to be recovered, right? So this cycle starts of importing some equipment, buying it, and then trying to make sense of the cost. Here I feel that CSRs in this country will be very useful, and with our NGO called as Synapse Brain and Spine Foundation, we have had good experience with some CSRs. For example, recently one big CSR donated the most advanced microscope to us. Now, just imagine the use of this microscope which is donated is that I can choose my patients ethically. I'm not forced to operate on patients in numbers, but only depending on the merit, because the cost of the microscope I'm not going to recover. I'm not needed to uh, recover that cost. So this is a very important point. From government point of view, if it is possible for them, if they reduce the duty on these equipments, if we start in future making these equipments in India, I don't see this happening too soon, but these niche equipments should not attract too much of the duty if we really want to create good healthcare in this country. But this is for the policymakers to decide. The other challenge with technology is, of course, people are not aware about the availability of the technology. And what happens now, because of the insurance business that is growing in India, insurance tells people that, look here, for your particular surgery, this much cost can be given. Now it is almost like insurance companies saying that this surgery costs this much. But then what happens is that people are not aware that this surgery can be done in a better way with better technology. So if better technology is to be used, it cannot be done in this cost. So this problem has cropped up because insurance companies have started dictating the cost of the treatment, for which I don't think they are justified doing that. What insurance company can say is that you give me 5 rupees per month, so I will give you 1000 rupees. They cannot say that a particular surgery or treatment should fit in this much. So this is a constant problem, and it needs some answer. Talking about the center of excellence that my team has created over the period of last 18 years, we are in the 19th year now. I must mention our long work and focused work about a disease called as trigeminal neuralgia, in which there is very severe pain on one side of the face and gums. It is also called as suicide disease, and many people are treated wrongly by dentists or psychiatrists before they come to us. So we decided to focus on this and perform surgeries to cure this disease, and it can be cured with a surgery called as microvascular decompression surgery. The problem with this surgery is that the results are good if the patients are operated in high number centers. So we wanted to create a high number center for this, and I'm very happy and proud to say that we have performed more than 2000 microvascular decompression surgeries in the last 15 or 16 years, and we have recently presented this audit in an international conference, and certainly we are giving the best result with least complications. Now, this vision, is very important, that it is very important that this vision spreads in other areas. Our other areas like brain tumors, create a center of excellence. Unfortunately, in India, unlike US, the concept of tertiary center has not yet developed. We have been able to create this center of excellence for MVD surgeries, microvascular decompression surgeries. And we are doing these surgeries with modern technology. We have the best and most modern microscope for that. We have the best endoscopes, which are designed specifically for that surgery. And here is the example how the CSR has helped us, because we may not have been able to buy these equipments, but because of CSR we got hold of them, and we are giving better results without charging more to the patients. So it has helped us to build this center of excellence even more. So trigeminal neuralgia, because of the pain coming from the gums and face, sometimes is misdiagnosed, and these patients tend to go to dentists first. Sometimes because of those shrieks of pain, people are taken to psychiatrists. Some people are taken to ENT experts. So a lot of time is wasted before the actual diagnosis is made, and then after that, for the people to know that there exists a center of excellence in India and then come here, it's a big journey. So public education about symptoms of such disorders, because neurology has got some clear symptomatology. It is also very important as a policy of the hospital and of the government. It is very important that public is made more powerful in understanding their own problems. Yeah, I remember one case which actually prompted us to start this Center of Excellence for Trigeminal Neuralgia and Hemifacial Spasms, that is MVD Surgery Center. It was, I think, in 2004 or 2005, when I was sitting in my clinic, that a patient with a long beard came and sat in front of me, and then he took out a bottle of insecticide and kept it in front of me. And it was, the scene was like one unfolding from a Hindi movie. So I was really afraid, what this guy is going to do. But then he said, "Doctor, if you don't treat me properly, I'm going to drink this." So I said, I started thinking whether I should call police or something like that. But then he said, "No, I'm suffering from trigeminal neuralgia. I have not shaved for nearly 2 months because of severe pain. I have taken all sorts of medicines. I heard that you are interested in this subject. I have come to you with the hope and surgery. If you don't cure me, I am going to drink this." Now, this is a very exceptional experience. And it so happened that we operated on him, and then he recovered. His pain was cured, trigeminal neuralgia pain was cured. And then he told me his story that he was an engineer passed from IIT, and he had a big industry in Madhya Pradesh. His problem was not diagnosed, initially misdiagnosed, his teeth were removed, and then he went to psychiatrist, he became alcoholic, his industry collapsed completely, all because of the fact that he did not know that such treatment is available. And before he went back to his home, he told me that you have to create a center where you treat such patients. treat this misery, which is called as suicide disease. And that's how we started, operating more and more on trigeminal neuralgia and hemifacial spasms with MVD surgery. And that has really paid great dividends. It's just an example of how a patient can induce you to think differently and create a center of excellence.